Female genital mutilation, a practice of partially or totally removing the external genitals of girls and young women for non-medical reasons, is a form of violence against women and girls that has been in existence for 1,000 years. While the origins are confusing, ending female genital mutilation, which is a cultural practice, is key to addressing gender-based violence and illiteracy. Witnessing another milestone in the joint effort to improve the well-being of women and girls in Nigeria, the federal government reiterates commitment to addressing all forms of harmful practices that have damaging impact on the health and well-being of women, adolescents, and girls. Witnessing another milestone in the joint efforts to improve the well-being of women and girls in Nigeria, the federal government reiterates commitment to addressing all forms of harmful practices that have damaging impact on the health and well-being of women, adolescents, and girls.
To make further progress with the scale-up of ongoing interventions that we are gathered here today to witness the launch of the National Policy and Plan of Action for the Elimination of Female Genital Mutilation and the National Protocol on the Management of Complications of Female Genital Mutilation in Nigeria by the Honorable Minister of Health. I believe implementation of these key documents will contribute towards achieving our set targets.
Recognizing the continued practice of female genital mutilation, despite concerted effort to eradicate it, we must acknowledge the plight of girls and women living with it at present, or those who are at risk of its consequences. It is therefore important to improve access to care for victims as part of efforts to deliver comprehensive quality healthcare services to all Nigerians.
Condemning the practice of female genital mutilation, a call was made on all Nigerians in the fight against female genital mutilation.
Ladies and gentlemen, human rights includes women's rights. So I must therefore emphasize that female genital mutilation actually violates the right of women, adolescents, and girls, and is therefore against the law because it violates the right to health, the right to safety, and the right to physical integrity, and could also cause serious psychological and social adjustment problems.
It is a violation against human rights, and it is most dehumanizing because it destroyed the pride of women. It gives them complete low esteem and reduces them to an object. This is most unacceptable, and I want to call on all well-meaning Nigerians to join hands with us, that is the Ministry of Health and the Ministry of Women Affairs, for us to condemn this harmful practice in its totality.
Stakeholders also lent their voices to the importance of national female genital mutilation policy.
The developing national and state-level FGM response coordination bodies and financial gains by people within communities. The continuation of this harmful practice contributes to sustain gender inequalities, increased risk of HIV infection and mental health issues. It was deemed necessary to review the National Policy and Plan of Action on elimination of FGM in Nigeria to reflect the current realities of the pandemic. The finalization of the costed National Policy and Plan of Action for Elimination of FGM in Nigeria 2021-2025, which was developed with support from the UNFPA-UNICEF joint program, remains one of the key achievements in.
And I would say it's an important policy because of 3 points. One, it sets a clear direction for the country for the next 5 years in relation to FGM. 2, it gives a comprehensive approach looking at the complications due to medical complications of FGM, but also looking at social behavior change at community level. And three, it gives us all a clear direction with respective roles as to what we have to do. There are two issues that are worries. One, there are new hotspots in the northern part of the country. We need to be aware of that. Two, the practice has been increasing on girls between 0 to 14.
The Ministry of Health is said to remain committed to eliminating female genital mutilation using a holistic approach to fighting gender-based violence in Nigeria. Also, the National Policy and Action Plan on Elimination of Female Genital Mutilation is for the period of 24 years, which started in 2020. From Abuja, Mavis Ako, KAFTAN TV News.